All set, Bob.
Okay, thank you, Matt. Appreciate it. Welcome to the Community COVID-19 Task Force meeting of Wednesday, June 10th. We have a detailed agenda, long agenda. It's a little slightly different, thanks to some additional inputs, but it's essentially the same. It's just reworked in a little different flow. So today's theme is public spaces, town density, and we'll probably get into some monitoring of other amenities. I don't have any minutes, so we can skip that. All of us on the task force have received a memo, the memo from the town manager. It is attached to this agenda, and it asks the task force to look at public spaces. We've already talked about private spaces, and private spaces are now being used for outdoor dining. But the next issue that they would like us to look at is public spaces, that being spaces that are essentially owned by the town, and how those might be able to be used to enhance someone's business that is suffering right now because they don't have their own personal space, particularly in case of restaurants, where they could put outdoor tables. So because this is it's a detailed memo, you can see, and we've all read it. I wanted to lead off with this and begin a discussion on this, basically to start off on, do we want to pick this up as a task force? And if so, I think we need to garner everybody's opinion first, because I don't think we'll come to any conclusions today. We may come to some conclusions on some issues, or at least have a working understanding of what we would like to do next. But that, I leave that up to you. So I'm going to open it up to the vice chair, Pam, and I know she wanted to make some comments. She has a schedule conflict later in the meeting, so I wanted to give her a chance to speak first. So the agenda item that we're now talking about is the public spaces memo, and we're going to go around the horn and see what everyone thinks about the memo and what they think we should be doing. So Pam, you can go first.
Thank you, Bob. I did, just before I start that, I sent everybody an email prior to our call today talking about an update from Jason Corbin about music in the park and about the website, in case I have to leave before the meeting. We get to that on the agenda, so you have that there. I read them, obviously, the town manager's memo in detail 2, 3, 4 times. I actually did go see her because some of the details on here I didn't understand what she was trying to do in some of these bullet points. But before I even get to that, I feel this might be something we could take up, but I personally feel we don't have enough information to talk about this. We don't know what the police, what the fire, what Public Works feel about doing something like this in terms of closures. And I'm only talking closures. I'm not talking one-off parking spots or anything like that. I know that Pat was still working on one request that has not been completed yet. I feel the fact that there has been no input at all at this point, from any of the vendors or business people along the areas that closure has been brought up, i.e. if you're a lodging, somebody who you're doing lodging, somebody who's a restaurant, somebody who has delivery, somebody has to get their their guests in and out of there. We don't know what they think. They're actually residents in the area. If you're doing the closure from Main Street to School Street, there are people that own homes in there. I did ask Pat one question. Was this a 1 or 2 day type of thing? Was she looking at like Bon Air? And she said, no, she was hoping that if it had to come to this, that it would be a couple of weeks or longer, months or so, and that she would not expect any traffic to be going down there, that people would have to find other ways to get their get to their houses or get to whether it's one of the inns or one of the hotels that are in that area. So with that said, I really feel that we don't have enough information to make a concrete recommendation at this point at all, that we would need a lot of input, a lot of data. Listening to Becky saying that Canada may not be, the board may not be open to the end of July. That's a large portion of people that come down here. So I don't know what type of density we're talking about. And probably lastly, but the fact that when you open the sides of the streets or you open an area for a larger expanse to social distance, that doesn't necessarily guarantee that people are going to social distance, that they're not going to wear masks, that they're not going to stay 6 feet apart, that they're not going to do all the things that we've been told will help and prevent this virus to spread. So those are my feelings at this point in time.
Thanks, Pam. Okay, I'm just going around my screen. It's all random. So, and I did put under this topic, the business group, and I'll end with Alice so that then we can take it from a business subgroup perspective. So Rebecca, you are next on my screen. Rebecca, you're muted.
I have an easier time thinking about the restaurants than I do about retail. It's hard for me to imagine people putting racks and displays out on the sidewalk unless we carve out some space for people to walk in the street instead and protect those areas. So in terms of restaurants, I guess the other issue for me is how to do it fairly. So if we near restaurants that didn't have any access to outside space, would that be considered a fair way to do it? And I'm not quite sure what people would say about that. The other thing is, I don't know how feasible it is for restaurants. If we said, for example, they could use Dorothea Grant Park, how feasible is it for them to cart everything, to set up a tent, to have extra staff to work that space? I'm not quite sure if they would be interested in that. So that, like Pam said, we'd need a little bit more information. And the other issue for me is what's considered outside space. My understanding is that it's 3 sides have to be open if you're using a tent. And so what if the weather is not very good and you're putting down plastic or vinyl? Are you still considered an outside space? So I have a number of questions that I have about how we could do it, how we could speak to the issue. And that's as far as I've gotten in my thinking about it.
Okay, great. Thank you, Rebecca. Kent, you are next on my screen.
Thanks. So I would say what Becky and Pam said, by and large, we would need more information for certain. And as we think about the public spaces available, if they're repurposed for these type things, where does the parking go at that point? If the sidewalks are used for businesses, where do the pedestrians go? And if the pedestrians go into part of the street, where does the traffic go? So those are the things I wonder about, and what information we have around those, or possible solutions that have already been thought out by the town. I'll leave it at that.
Kent. Thanks, Kent. Terry Ann, you are next.
Yeah, I have really was hoping to have a little more clarity about what Pat and the select board were looking for from us. So first of all, I want to say that from a public health perspective, anything we can do outdoors is better than anything we do indoors. So I do want to caveat my thoughts in that way. So what I'm looking for is guidance. Do the decision makers want from us a thumbs up or thumbs down? Do we use public spaces or not? If they want to us to consider the public spaces on the list. And there are some, maybe, well, which ones should we look at? And then if it's some or all, do they want some guidance around the conditions that we would recommend be met to optimize public health and safety for residents, for workers, for business operators, and for visitors. So I'm kind of looking for, in those 3 buckets, what is the town looking to us for?
Okay, thank you, Terry Ann. Charlie, you are next on the screen and you are muted.
Okay, my thoughts are anything we can do to help somebody stay afloat through this pandemic is okay with me. As long as it does not make it more unsafe for anyone, whether because of the spread of the pandemic. In other words, the social distancing is made more difficult, or putting them at risk of walking in the street where it would be unsafe. From what I've seen so far, if things continue the way they've been, I see very little trouble because of the lack of numbers. You know, you go down to the beach during the week, even on a hot day, during the week especially, I really don't see an issue. And I'll reiterate what Terry Ann just said, in that outside is much safer. I was listening to a show, I think it was on NPR, and the doctor who was being interviewed said that because most of these rallies recently about the police and everything, you know, Black Lives Matter rallies, mostly outside, it's going to mitigate the spread of COVID-19. So far, that's what's been shown anyway. So I would be very much in favor of as much outside as possible, because I know there are some vendors, some businesses and restaurants and so on in town that don't have much space. So I'm all in favor of trying to help keep them afloat. Thank you.
Okay, thank you, Charlie. Buzzy, you're next. Buzzy, you're on mute.
Yep. Yeah, I agree with Rebecca and Kent and Terry and Charlie in a certain way about the retail. I can't really speak to that. That's going to be a tough thing for them, what they think would work for them. I just don't. I think we should definitely have a voice in this decision. And then secondary, I think you can't have it both ways. You can't have a business make it, and I think we're going to be able to designate public spots to businesses. So I'm against using any public spots for any businesses individually. You want to make community spots or community picnic tables that everybody can take takeout to or something like that. We could talk about that. You lose parking or something like that. But individual restaurants taking or any place taking public spots is counterproductive to what we're trying to do. As for closing streets right now, I think just staying focused on the mask distancing and hand sanitizing is key enough. Then all of a sudden we're going to start diverting again with traffic. Whoa, we're going to be pushing water uphill. So I don't even see a need for that. But I'm done. So yes, we need it. I want a voice, and two, for those, that's where my head's at. And I could be convinced I'm wrong. Okay.
Thank you, Buzzy. Rick, you're next.
Yeah, I think if they sent this to us for a reason for us to consider. One of the things, I know Alice will speak to a lot of stuff that we talked about the other day, but one of the things we discussed was if you closed off the tip of Shore Road and had then diverted traffic through Jacob's Lot, and I'm not saying do it, but if you did, that would allow for pedestrians to be using Shore Road through those areas. And so people who are waiting outside for restaurants or to wait to go into a shop could use the sidewalk and not worry about having to bypass other people. That would be one example of a good use of this tool. And as we've seen at this moment, we don't need that tool. And we don't know what the next month and a half is going to bring. But I think but I think we just need to sort of think about those areas. And that was just one that we had talked about, that could, again, we're not looking to put picnic tables or put tables out there with merchandise. It's really just to create a pedestrian corridor a little more comfortably. Thanks.
Okay, thank you, Rick. Alice, before you go, I'll make a comment as a task member and not the chairman. If that, okay, and then we'll turn this over to you to bring your personal opinion and the subgroup's opinion and the chamber's opinion. So that's kind of how I structured the agenda here. I personally think we shouldn't close roads, but I also believe we should look at issues on a case-by-case basis. So much like the town manager is looking at Bessie's with regard to some parking spaces, probably we could do that type of work if someone came and said, look, I have an idea, what do you think of it? We would ponder it, discuss it, vote on it, and then bring it as a recommendation or not as a recommendation. I think that could be something we do. It is a little time consuming, and maybe that would work against us. I personally believe that the big crowds aren't coming until after July 1st, when people can bring certificates to show that they are disease-free, and then we'll start seeing a greater influx here. But I think in the short term, again, we're pretty flexible. We've shown some ability to be nimble. We could address certain specific issues on public spaces that someone came to us with and said, hey, I think I could do this and it would really help my business. What do you think? I'm like Buzzy. I think just deciding to close roads without thinking about people who live on those roads or people getting access to those roads, because I know if someone closed my road and said, you got to walk down to here to get to your car, I wouldn't be so happy about that. That would make me a little bit disappointed. But if someone said, if I could carve out this amount of space and it doesn't impact traffic, can I use this space to get a little more table coverage or a little more retail space? I personally don't have a problem with that if it made sense for the business owner in question. So let's move it now to Alice. Alice, you can speak as a member of the task force, as a member, as the leader of the chamber, or as a leader of the subgroup. I think that's what we can kind of bring this together from your perspective.
Okay, so first, personally, as a member of the task force, I think we need to have a better understanding of what are the business needs in our community. Do businesses need more space than they have? This past weekend, I think the retail stores probably never exceeded, 5 people in them at any one point in time, but we don't know what town's going to look like on July 15th or August 15th either. So I think we need to identify the business needs, and then based on that, develop some scenarios that would make sense based on what the needs are, because perhaps the needs aren't even there. And then maybe we run those scenarios, give those to the town manager, have her work with the police and fire departments to put together a proposal that we could then review, because again, they have the resources to set up the safety protocols that we do not. And then they could say, hey, this is what we're thinking. I've consulted fire, police, all the important safety people, Matt, and these are a couple things that we think from a safety perspective might work, and then we can mull that over. That's kind of how I see our role, because I agree with Buzzy. We definitely need to have a voice. That's why there's a business subgroup of the task force, and the businesses and residents need to work hand in hand to help our community recover. As head of the business subgroup, some of the things we talked about on Monday were helping Pat to define kind of what the select board is allowing her to do by making a recommendation to the select board. And when it comes to private space, what our subgroup would propose is that, for instance, Hartman House Inn, Jim Hartman contacted the chamber and said he would be happy to share space with anybody who needs space. Clay Hill Farm did the same thing. So if there are private entities that want to offer their space to another private entity, I think we recommend that they work, the business subgroup recommends that they work together, figure out the logistics, and then they notify Scott Highland, the code enforcement officer, so he's aware of what's going on and can be prepared to deal with any kind of issues that might arise from the arrangement. We talked about public space. And again, like I alluded earlier, it's quiet in town right now. I mean, we don't know what it's going to look like a month from now, but maybe, wait on public space until after we get some data back from the businesses. And so putting my chamber hat just for a second, the chamber has sent out a survey to all of our business members about a proposal to use privately owned space that this business would make available to a number of chamber members to do like an open air market. So we're just starting to get that information back, and we're supposed to have all of it back by Thursday night in order for our events committee to take a look at it on Friday, because it's something that the chamber would be running for its chamber members. So that's going to give us a little bit of sense about, is there a need? Are people willing to set up in public spaces? Now, this wouldn't be a public space. This is a private space we're talking about. But if we hear from our members, we don't have the staff. We don't have the time. The investment of our time and resources is not going to be worth the return on investment. And if we start to hear that just through the chamber, I think that probably represents the business community as a whole. So that's one thought we had on that. We talked a little bit about the potential for congestion. And again, as you have heard so many times, I've never been here in the summer. So I was actually in town on Saturday talking to one of the business owners, and I was like, oh, it's nice to see people in town. Is this what it's like in June? And he's like, no. I was just happy to see people on the sidewalks. But right now, the lines don't seem to be an issue with the restaurants. The restaurants are taking reservations, or they've got sort of curbside pickup. People are getting out, going to get their food and getting back in their cars, at least downtown. I'm not sure what's going on in the Cove because I haven't been to the Cove. I didn't go to the Cove this weekend. But we talked a little bit more about retail. And initially, since it's not that busy yet, our subgroup felt that we need to help educate the retail business owners that they need to be mindful if they have more than 5 people and they're starting to develop a line outside of their business, that they shouldn't allow the line to just grow. That maybe they, say, okay, we're going to allow, up to 2 to 4 people to stand in line. After that, we'll just ask people to take a little walk and come back, which is what's happening if somebody comes to make for their reservation, maybe their table's not ready yet. The restaurants are saying, go take a walk. We'll text you when you're ready, come back then. That was an example of limit the line to say no more. I think this was Buzz's idea, no more than 1/3 of the people you could accommodate in your space, and keep an eye on it. Kind of monitor what's going on your sidewalk, understand that space, your line outside of your store is really part of your store, even though it's on the sidewalk, and that you need to be mindful of the behavior in that space as people are waiting to get into your store. And just monitor it through June. So we're ready by July. If we see that things are starting to pick up when we get a little bit closer to the 4th of July, maybe we do come up with something more detailed. But I had said, gee, do we ask everybody to make their lines go north on Route 1 so that everybody's kind of lining up in the same direction? And the business group just felt it was kind of premature to even get that detailed until we kind of get an idea of what's really going on in town. And then we talked about Rick's idea about, if we close down public space, let's make it available for pedestrians or, tables for people to sit and eat so that we reduce the congestion of people on our sidewalks. So that's a little bit about the business subgroup. And then from a chamber perspective, I would just say, we're waiting to hear about should there be a push for any outdoor space? And once we get the survey results back by the end of this week, we'll have a much better feel for, is there a need for this? And I don't think we need to go too far down the line if, in fact, there's no need for it.
Okay, thank you, Alice. I'll tell you, that helps me a lot, because now we can, we got the memo on Saturday or thereabouts. It's Wednesday. I agree with everybody so far. We need more information. I'm not kicking the can down the street, but we got to come up with some more details. And I think it's very important for what the chamber is doing by Friday to see if anybody really has an issue and wants to do something. If they do, then we should take it up. And I think we should continue to monitor this discussion and this question. We don't know what the governor's going to do. We don't know how the density numbers are going to change or not change. We may learn something more in a few minutes here on the virus itself. I did say that if somebody in the public wanted to make input, we would do it now on this topic only. Please don't go off topic. Matt, is there anybody with a hand up on this topic in particular?
There's no hands up yet, and I didn't see anything in the chat
Okay,
box yet.
okay. All right. One other corollary to this, and then I'll get to Rebecca, is I had intended to go to the select board last night, but there wasn't a select board meeting, so I was all alone on Zoom, looking at myself. That's not true, but a little humor. I did go down to the beach as promised and looked at the bridge. I would say we think very clearly about making the bridge crossings one way. Now, you might say, well, we're not making the town one way, we're not doing this one way. The issue I saw was people are doing the social distancing, but they're jumping into the street. Okay, so there are cars going through the street and people moving that way. I think that's more dangerous to me than anything that I've seen so far in the town. So I was intending to go, and I think we had already kind of discussed this either by email or from our last meeting, to say we ought to do something about that bridge in particular. And I got some feedback that said, well, why don't you do that for, other amenities? And I said, well, other amenities don't have cars going up and down the street while people are trying to jump out. This is just one place that we could make it with the crosswalks and maybe with some service people to help direct on the weekends. It could make it a little bit safer, especially from a vehicle standpoint. I intend to go and have that discussion next Tuesday when the select board meets. The question now is, so we have no public input, we have our conversations here. I think it would behoove us for me to go to the select board and say, and we'll see what the chamber comes up with. We're still working on this and we're still thinking about it. And the business subgroup needs to meet again to still keep fine tuning what it is we really could do. I think that probably would help us stay in touch. As Buzzy says, we should be the ones who look at this, but we don't have anything we can really say right now that's concrete about doing anything like closing roads and that kind of thing. Rebecca, you had your hand up. Becky?
Well, given that there is a specific request to Pat from Bessie's, and Pat's asked for our opinion, do we know exactly what Bessie's is asked for? And if so, do we have an opinion about it?
Pam, I don't personally have any information, but Pam may have more information than me.
I do. They've asked for 2 parking spaces, not the handicap space, but the next 2 spaces going down on Shore Road. As you go from Main Street down Shore Road, would be on the right-hand side. They have had conversations with Pat. Pat has said that she was going to allow them to do that. The select board gave her permission to make that decision, not necessarily with us. At our last select board meeting, they said, Pat, you handle it. It's a one-off. It's just a one request. As of today, and that was last week, the establishment, the business establishment, has not received any indication, yay or nay, in writing what they can or cannot do.
Okay.
I don't know if that helps you.
Well, that just brings up one other issue. An overriding issue was the abutter issue, whether the businesses alongside Bessie's there, whether that would disrupt what they do or how they would feel about it.
I do know that the businesses on that side of the street the owners of the establishment in question have met with all of them and talked to all of them and have provided that information to Pat.
Great.
So that much I do know. But again, I do not know what her recommendation is. I think the one thing besides the one-off, I didn't hear anybody say, I know I said I'm not in favor of road closures, and I know Bob said that. I don't know how anybody else feels about road closures. Again, 4 or 5 bullet points that were in this memo that were given to us all speak to road closures of some kind, not just using a parking lot, so.
So to clarify for me, I don't think we should go through a plan of road closures, but if we did see something that made sense through more discussion and more requests, we could possibly look at it. But I wouldn't vote today on any road closures, or in point of fact, I'm not that thrilled about road closures. I'm more interested, is there some space on sidewalks that makes sense to make it more cafe dining? I don't know if that exists. I kind of walk around now a lot. I go up and down the streets looking, but I think we need more input, one from the chamber, and we need the businesses to say, I would like to try this. And then instead of Bessie's going to the town manager, they could come to us and we could look at it. I mean, that's one way to look at it. I'm not saying we should do that. I'm just saying that's one way to proceed. I think as a general consensus here, though, it's clear we're not ready to make any concrete decisions. And we will continue to have this conversation. I think, Alice, I don't know how we'll fit it in, but we should have a meeting with the subgroup again soon after you have your chamber data and what in terms of what they want to do. Is that, just by nodding heads, is that a fair way to characterize the discussion so far? Any concerns? I got Charlie, you're okay, Rick, Kent, Buzzy?
I
Yeah. Define. You're on mute, I think.
Sorry. Okay. Yeah, for the most part, I just want to make it clear that I don't want to think that we, that using public spaces on any one-off issue is not the whole issue. So I don't think that individual cases, because I know how much this code enforcement officers work to de-grandfather clause this town, is kind of going to be problematic. So I would like to know if Pat's listening, then yeah, we definitely have some questions about using public space for any business holistically or individually, either way. So you can phrase that into your question. Thank you.
Thank you, Buzzy. Okay, Terry Ann and Charlie, and then we're going to move on.
I mean, if Pat's gonna deal with that, then we don't need to weigh in, but I would say that I don't think there's a one-off, if you will, based on what we've been potentially asked to do, which I still want clarity about, because, at the end of the day, allowing one business to use public space creates an issue for every other business that may want to use public space. So I'll be interested to hear what the chamber comes up with about what the need is. But I think we really, I would caution one-off decisions until the decision makers have a framework within which they're going to make those decisions, because there are all kinds of public health considerations whenever we allow public space to be used by one, not all. So I don't see it as a one-off, but if she's prepared to make the decision, I would not second guess her, of course.
Okay, Charlie, you're the last one to speak on this topic.
I have a strong feeling that having been on Church Street in Burlington, Vermont, and other streets that have been closed and used as pedestrian thoroughfares, that I feel it would be useful to be able to do that. For instance, I sent you an email a while back, Bob, it had to be a week and a half or so ago, suggesting just that Shore Road could easily be closed from Main Street to School Street. And that could be a pedestrian walkway using, other ways to get around. So, you know, I'm strongly as a person who likes to walk around and who has seen streets closed down like that in several areas where it's very advantageous to the business owners. They'll put tables out there in what used to be a street. They'll put, you know, racks of clothing out there, and it really works in those areas. We don't have to reinvent the wheel here. It's something that's worked in other areas. I don't see why it wouldn't work here. As a matter of fact, it was suggested when we applied to be a bicycle-friendly community back about 6-7 years ago. That particular thing was suggested by the people who came in from different cities to look at our town. So anyway, that's something that I think done properly and with the advice of the police and fire departments and so on, I think it would work. And like I said before, I'm in favor of anything that helps to keep businesses in town afloat. Thank you.
Just one quick one, and then I promise I will shut up about this subject. The fact that at the last select board meeting, the select board tasked Pat with making a decision for this one particular business. Are we saying that she should continue on with that? I mean, I don't want them to be kept in limbo when other businesses are already being able to operate and they feel that they can't. That's my question. Is this task force saying it needs to come back to this task force, or are we recommending that the select board recommendation to Pat just stands through?
Select board already gave her the authority to do that, and I don't think we should have the right to step up and say no. I think let her handle it, and then that's when, because they gave her the authority to do that at the last meeting.
I'm sorry, I didn't hear the beginning what you said, Rick.
The select board actually gave the authority for Pat to make the decision on this particular matter. So I don't think that we should really be trying to step in and step on that. I think in future discussions, we can make those that we would like to be a part of.
Okay, I agree with you. So that's why I just wanted clarification. Thank you.
Okay, thank you. So that is that issue. And we will now move to the next agenda item. And this is Charlie's agenda item, and Charlie has brought a guest. Charlie, you have the floor.
Yes, I have. Okay, let me get unmuted here. Hang on.
You're unmuted. You're okay.
Okay.
Yeah, we can hear you.
All right. Just wanted to make sure. So I watched Dr. Shaw's press conference again today. I'll give you a quick update. Our positivity rates are continuing to go down. They're at 4.68%. There were no deaths today. We're at 100, which we were at yesterday. And it seems the positivity rates, like for the day, they did 1,541 tests, he said, in the last 24 hours. 46 of those were positive, and that gave us a 2.99% positivity rate for just today, or the last 24 hours. So it's pretty exciting that we're going in the right direction now. Having said that, I happened to run into Eric Fogg at the golf course the other day and had a very interesting conversation with him. Eric is the director of walk-in services for York Hospital, which means all the walk-in services around us, including Wells Urgent Care, the ones in York, Berwick, Sanford. There's also one in Kittery. So anyway, he's got his finger on the pulse of what's going on more locally. And he gave me some information about Eldridge Lumber and a few other places that I'd like him to share with you, but he also has many more numbers and things. So I'm going to turn it over to him. Eric, would love to hear what you have to say. We spoke this morning, and he said he has some stats for us that are more locally and so on. So if Eric would take it away, I'd appreciate it.
Great, Charlie. Thank you. And thank you for having me on. I participate in several of these forums like what you have here, and it's great to connect with the communities. So my time certainly is your time today, and I welcome any questions. As Charlie said, I do have my finger on the pulse. I also stood up the new drive-through COVID testing site at our Route 1 location starting last Monday, and I oversee that project, which has been interesting to watch it grow. And really, we fielded a ton of phone calls after Monday's announcement by the governor's office as it relates to the Keep Maine Healthy plan that also describes something you all are probably interested in terms of bypassing the 14-day quarantine with a negative test within 72 hours. So be glad to answer any questions as it relates to that. But one thing I'll start with that I think you'll find interesting is we track at York Hospital what's called our gating criteria. That's GATING, gating criteria, which looks at our percent positive cases, our total number of tests, our total number of positive cases, as well as our hospital admissions. And we did something this last week, May 31st to June 6th, that we have not done since the first week of March. And that's we showed a 0% positive rate for that week. In other words, we have not had a positive case at York Hospital for now 8 days. We have not had a positive hospitalized patient at York Hospital for 13 days. So very, very interesting. I don't know how you folks will interpret that. One way to interpret that is, wow, hey, this is great. Are we out of the woods? Is everything hunky-dory? Or does that give people pause and concern awaiting potentially a next wave? So that was how I thought I'd start off my statistics here is the great news. So when Charlie gave you the statistics about the percent positive on the state at 4.6, that's the entire state since inception. We've been hovering around 2% dating back to the last week of April, with turning a 0% rate last week. So just last week alone, we did 327 tests through our York Hospital system. And again, we had 0 positive. The week before, we did 307 tests and we had 5 positive. So in the last 2 weeks, we'd have 5 positive with over 630 tests. So that percent positive rate is statistically very small and really indicates, you hear the term community spread, it really indicates that there's not a lot of community spread going on, certainly in our neighborhoods currently. So that's that statistic. Charlie asked me to touch a little bit about the Eldridge Lumber situation that occurred some time ago. That's a local business that probably caught folks' attention. As many of you heard, around Memorial Day weekend, there seemed to be an outbreak at Eldridge Lumber, which required us as the hospital to go in and do some contact tracing and testing. And ultimately 13 people, Charlie, that's an update on that. I don't know if that's exactly what I gave you the other day, but 13 people tested positive as part of that contact tracing. But what was interesting about that story was Dr. Shaw brought that up in a press conference last Wednesday, I believe, almost a week and a half after the outbreak, which interestingly resulted in multiple people presenting to my testing site who heard about this via the news and had fear that they might have been exposed and were requesting testing. But that quickly stopped at 13 positive cases, and there's been no subsequent positive cases coming out of that. The other local institution that had a small outbreak was Durgan Pine in Kittery, which is a long-term and rehab facility. They had 6 cases positive back 3 weeks ago. So you've heard about some of these long-term care facilities, not only in our state, but across the country, having problems with outbreaks in those institutions. Luckily, the Durgan Pine one was caught early, and they only had 6 positive cases there. So overall, York Hospital, since the inception of our kind of pandemic state of emergency, we've had 20 patients hospitalized since the first week of March. We currently are at about 70% capacity hospital-wise, and we're at 40% capacity in our ICU. We have 6 ventilators at York Hospital, and we're only using 1 as of today. So those are some of the metrics that you hear people talk about. So if you find those statistics interesting, be glad to continue to share them with this group. But that's the high-level stuff. But I welcome any questions from the group, or how can I best provide information to you all?
Okay, thank you. Should I call you Eric or Dr. Fogg or Mr.
Eric's
Fogg?
great. Eric's great,
Okay,
please.
Eric. Okay, Eric. Thank you, Eric. Rick, you have a question.
Eric, thank you for all that. That's helpful information for us. As business owners, some of us, or in owner, as a matter of fact, is it possible? How does this all work now? Let's say we have somebody from Massachusetts who wants to come and stay, needs a test. Is it possible for them to get it from you? What do they need in cost and time? I know it's a lot of questions in that one question, but I'm sure you've heard this many times, that your number of phone calls, I'm sure, are those same questions.
Well, today my project all day was working on a FAQ and a phone tree, because our phone systems nearly collapsed in the last 48 hours with a lot of these queries. But to get right to the meat of it, so the state did 2 things with their announcement that impacts, I think, your question. Number one is they've put out a plan to stand up 20 new test sites within the state. 4 of those are proposed here in York County, and you can go to the Maine State CDC website and link to the DHHS and see that. It's really interesting. They aren't really giving a lot of information yet about how those are going to stand up. I believe, in looking at that map, that my drive-through testing site is one of those proposed sites, but I'd love to hear that from the state. So we have a couple calls into them. We have that call a lot. Massachusetts is one of the states that will require that. All states except for New Hampshire and Vermont, you probably heard that, right? They're exempt from the 14-day, so you're aware of that. One of the things the governor did stress, and I was glad to hear her do this, is they prefer people get that test prior to coming to Maine. You've heard that. It's know before you go, I think, is what she kind of has identified that. Because what that allows is, before you get here, whether you're have a negative test or not. We would hope that if you test positive, you'd stay home. Now, what we've heard feedback, and why our phones have been ringing off the hook, is some areas of Massachusetts, Connecticut, and whatnot, it's difficult to get a test if you're asymptomatic. And in knowing that true, I think the state wants to be prepared to welcome people safely to the state and offer testing. So what we're doing this week, Rick, to address that is the Maine CDC has listed a standing order. That term means that there exists the ability for someone to get a test now through this standing order without a provider order. And we are trying to implement that standing order within our testing protocol. We're not there yet. There's some technicalities to that and whatnot. And a lot of the governor's plan really launches July 1 as part of that Keep Maine Healthy. So I think the easy answer to your question is we are working on a way to do that. If you don't have an order and we haven't facilitated that, the test site is adjacent to our walk-in, and our walk-in providers can go ahead and place those orders and get that done. I will tell you that it's already happening. We have had those requests, and we are doing those tests for people who come and seek them at our testing location. We just haven't totally formalized that particular request, but people who come seeking that, we're making that happen.
Pam.
What is the time turnaround on that?
Oh, great.
That's what I was going to ask.
Yep. So I will tell you, behind the curtain, as they say, York Hospital, and this is true with most hospitals, we've been sampling multiple labs since this started. Our goal is always to get the quickest turnaround, because it's critically important, as you can imagine, to us with hospitalized patients and whether we have to wear PPE and patients under precaution and all that. So currently, we use a lab out of New Hampshire called Seacoast Lab, and their turnaround is 8 hours once they receive the test, which is fantastic. Now, I point out once they receive the test, I collect it at the walk-in, it goes to the hospital for processing, gets couried to the lab in New Hampshire, and then it's 8 hours. So how that plays out in real time is about 24 hours. I do wonder, and I'll answer a question that you probably haven't asked yet. I do wonder if there's a huge increase in volume and testing, how that will impact labs' ability to turn over test. And as you all read, the state has partnered with IDEXX to increase their capacity to 25,000 tests a week. And if that's the case, we can shift gears and send these tests to Augusta if they have then the quickest turnaround. We can be nimble and change which lab we use to process testing, but right now we're sitting at a day turnaround.
Eric, you said that you could get a test without a provider. There was a standing order. Is that just for people in Maine or someone coming from Massachusetts or out of state?
Yeah, it's going to apply to people coming from out of state. The idea with these 20 swab and drive or swab and send sites is that they can apply this standing order. I think you'll see programs like this at like the CVS's. You probably follow the news and know that CVS is a testing site. They have 4 currently in Maine. I think the closest one to us is perhaps Biddeford, but Lewiston, Bangor. I wouldn't be surprised if CVS becomes part of these 20 swab and send locations. There's a CVS, I believe, in Wells. Correct me if I'm wrong. You folks know the area just as well as I do. One of my neighbors said they were in line at the drive-through at CVS picking up a script last night and said, "Coming soon, COVID testing." So I think you can apply these standing orders to places like the CVS. We're going to figure out a way to adopt that standing order as well for out-of-state folks.
Okay, I saw Kent, Rebecca had their hands up. So Kent, you're first, then Rebecca.
Thanks. Hi, Eric. So I have a couple questions, and you may have answered this already. For the tests for out-of-staters, those are reported in their home state statistics, correct?
Yeah, so when any positives, the CDC does give credit to the state of origin. Yes, so that's true.
Okay, then my second question is around age groups. We've been tracking positive results by age group, and we're seeing an increase in the age groups of under 20, 20s, and 30s. I wonder and that's at the state level. We can't seem to find any county level data. So I'm not sure if you'll be able to answer this or not, but we're trying to figure out why we're seeing an increase in those. Is it the number of tests that are being conducted now, and the older groups have gotten through much of the testing, or what's driving that, do you think?
Yeah, anecdotally, I'll tell you in York County, and you're right, the reporting, there's been a lot of requests to increase how the numbers are reported. The other request is by town. We're getting county numbers now, right? And folks want to know by town. Anecdotally, I'll tell you that we are seeing more of the kind of 40 to 70 age group. And the majority of those hospitalized patients that I indicated to you earlier have been the hospitalized patients have been in the 60 plus age group. And we've had 5 deaths at York Hospital since the inception. I don't think I said that from the start, but those 5 deaths were all 70 plus. I think one of the things, again, there's an expression in public health, the more you go looking for something, the more apt you're going to find it, right? So the more we test, the more we're going to find these cases. I also wonder, to your point with some of these, the college age kids have come home now. People are starting to get out and about in the community a little bit. And I'm wondering if that is attributing to some of this. I think a lot of the folks in the higher risk group are still heeding the advice of being conservative in their, I know my 70-year-old parents, I don't let them go to the Hannaford and grocery shop. I try to keep them on a pretty good lockdown and keep them safe type of thing. So perhaps that's part of it. What we do know is the cases tend to be milder, a little bit milder in those younger age groups. So for whatever that's worth.
Yeah, I think, just looking at that age data and kind of overlaying it on the town's business model, a lot of the staffs for our businesses are the younger age groups. So just wondering what risk that may inject into our town or the county from that perspective. So that's helpful.
Okay, Becky.
Hi, Eric. I was wanting to know, the state is supposed to have 205 trained contact tracers shortly.
Yeah.
And you say the York Hospital system has been doing it as well. Is there a coordination between the two? Are there contact tracers from the state that are designated to York County? How does the coordination work?
That's a great question. I think early on, you're starting to see the ramp up of this process. And so there is a certain threshold that the Maine CDC uses, and I'm not privy totally to that, where they intervene with an outbreak. They certainly have come forward with the long-term care facilities and to manage those. What's interesting is if you read the newspaper around the Durgan Pine outbreak in Kittery, the Maine CDC did not investigate that thoroughly because it didn't meet whatever threshold they indicated that would require them to come in. So a lot of those folks came to York Hospital to be tested. Our infectious disease team, led by Dr. Thibodeau and Dr. Volpe, worked with the administration at Durgan Pines to kind of help guide, I guess, that contact tracing. But one of the commitments from the Maine CDC has been to increase those contact tracers, and there's been a lot of people trained. We have not to date been assigned those to us or as a resource, but we work with our York County Maine CDC field representative, Adam Hartwig. And so we usually reach out to him to coordinate some of those things. So he is our resource and he's our contact. So we have a great connection to him, somebody I personally talk to at least once or twice a week. So that's our kind of chain of command, is when we feel like there's a threshold that's been met, we reach out and notify the Maine CDC.
Thank you.
Okay. I know Eric has another appointment to enlighten even smarter people than us. And I appreciate that. One question, Eric, you're doing a great job with your parents who are in their 70s. What are the parameters under which you think you would say it's time for you to get out and about and, lead a new normal life? Just curious about myself.
Yeah, I'll tell you what, I struggled with this. I work at a hospital. Right now I spend most of my days at a testing site. So I questioned, am I putting my parents at risk to even go and lay eyes on them and help them and check in with them? The social connection, as you know, is really important. And I do take precautions. I do wear my surgical mask when I go see my parents. I do stay 6 feet away. I do think it's important for people to get out. I love when my parents get in the car, go for a ride down by the beach, get sunshine on their skin and let the sunlight hit the back of their eyes and let the fresh air come in through the car. I think that's really important. I personally haven't eased off on allowing them to really get into congregate areas like a grocery store. As a matter of fact, I think our grocery stores are doing a phenomenal job. I love the partitions. I love the spacing. I think grocery stores are relatively safe. There's high ceilings. There's good air circulation. So as it relates to that, I remain conservative with that. It's probably just an over-conservative because my parents have comorbidities, and I unfortunately feel if they were to contract COVID-19 that they would have a very, very difficult clinical course with it. My sister who lives in my mother broke her hip 6 weeks ago, had to go to the hospital. I've been trying to keep her out of the hospital, and she goes and breaks her hip. And my sister wanted to come visit. My sister lives in Rhode Island, and you're stuck in this juxtaposition of Rhode Island was a little bit hotter of a state. And is this the right thing to do? But it's my sister. She wants to visit her mother who broke her hip. I struggle with it, honestly. But the bottom line is I try to use common sense. I try to use good judgment. I just do the best I can. How about that? Does that answer your question?
Yeah, I appreciate that. I know sometimes the personal stories are difficult during this time, but I think it's also good for people to hear how you're handling it. I think that's good experience, and I appreciate that. Any other questions? Because we have to let Eric go here. Okay, on behalf of the task force, Eric, I'm going to give you this Rolex watch. No, we don't do that anymore. I do. Terry Ann wants to say 2 minutes, Terry Ann.
One question, I just want to know, do you know what a COVID test costs if someone were to drive to one of your testing sites and wasn't a patient of the system? What would it cost?
Yeah, so right now the hospital cost of the test is $225. The great news is that it's been mandated by the federal government that insurance companies cover the cost of testing with no shared cost to the patient. So it bypasses your copays or your deductibles or those type of things. We always encourage people to check with their individual carriers. The commercial carriers can get a little funny at times about how they define their parameters. Certainly the federally funded insurance carriers like Medicare, Medicaid, and those are covering these at 100%. We've not had any issues with that. If someone doesn't have insurance and can't pay, I believe there is state money set aside to cover the cost of COVID testing. I know that both the states and the federal government didn't want that to be a barrier of people getting tested. And I also believe if we flip to this expanded state lab testing, that because there's federal dollars used to that, that might defray some of the cost. And so I'll keep you all posted on that, but it's a common question. And to that point, however I can support this task force or you folks going forward with information as you begin to welcome guests into your community, it's very similar conversations. I'm on the similar task force in York and certainly live here in Wells. And however I can help or be supportive, we feel the town of Ogunquit is part of our catchment area at York Hospital. And I know many folks use our services, so we're here to support.
Okay, thank you very much, Eric. I appreciate it. It's very informative, and thank you, Charlie, for asking Eric to join us this afternoon.
Great. Thank you very much, guys. Good luck. We'll talk to you soon.
Okay, bye-bye. All right, next on the agenda, we have Matt and an update from the field. Matt, you're on.
All right, not a huge update today, just a little bit more of the same. We've been having our CSOs on the beach, Marginal Way, Perkins Cove, and in the square. I would say on the beach, we noticed that there's not a lot of mask wearing as far as once people are on the beach and spaced out appropriately. They do appear to be following the 12-foot distancing between groups. It's a little bit, on some of the mornings of the nicer beach days, it does get a little bit congested near the ramps. But people are spreading out both on the riverside now and on the beach side. I would say we get some good data from you folks from the Marginal Way people counters, as well as some observational data from people going out and doing informal mask versus non-mask. And I'm sure, I think that, is that Terry Ann, did you send that to me, or I forget who sent it to me? Joan. So that was good information. We do have CSOs both on the beach and and Square and Marginal Way offering masks if people don't have them. So if someone doesn't have a mask, they are offering to provide them with a mask, a surgical mask that they have. And again, that's partly from a donation from an individual in town who donated a large supply of masks to us. So that's been really nice. I would say we've gotten quite a few or some complaints on the Marginal Way about people who aren't wearing a mask when you can't social distance. And I understand, and I think the challenge that we're facing as an enforcement end or as a police department or even you folks is that when you go outside, people lose the idea that they need to have a mask on. And I think you'll see that behavior at a supermarket or anywhere that people are wearing a mask inside, they come outside of the store and they take their mask off and they take a deep breath. And I think, well, I do think that mask compliance inside businesses and stores is really good in our observations. It's a little bit or a lot harder to get the message through about wearing it when you're outside. So we've been, one, trying to model that with our staff, and two, we've increased some of our signage. We moved the digital board at Buzzy's suggestion down closer to the sand, where people can walk up and drive up and have time to read it. We've tried to make it a little bit interesting to read. So we've changed some of the information that's on there daily, not only to maintain 12-foot distance, please wear a mask, but we've also put like the weather for the day, the ocean temperature, and the high tide times on. So it's a dynamic sign that changes every day. So hopefully that would keep people looking at it and hammering home those messages, even subliminally, about that. And the beach signage that you all weighed in on, we were able to get up or made and up. And I think those are at almost every entrance to the beach, all the beach ramps. And I think those are visible, and I think hopefully will help. So I don't have any groundbreaking new information, guys, but if you have any questions, I'm happy to try and answer them.
Pam,
I have to sign off, but I just had, thank you, Matt, for all that stuff. Did you put signs on the visitor services booths?
Yeah, there's one of those beach signs is on every visitor services booth, and there's also in preparation for opening tomorrow, some of the man lots. We've also added to wear a mask signs with the booths, and they've printed out some signage that says visitor services attendance only.
Thank you very much. Good luck for the rest of the meeting, everybody. Thank you. Bye-bye.
okay, bye, Pam, thank you. And thank you, Matt, for the update. If there are, everybody got so much bigger when Pam left. Ooh. Okay. All righty. Did I see someone raise their hand? Did I miss somebody? No, we're okay. Matt, thank you. Rebecca.
I was just curious if there's a sign. I'm at a disadvantage because I'm not in town. Is there a sign on the wharf lane, you know, the narrow bridge that goes from Shore Road to Beach Street?
I don't think there is a sign there that says we can get a sign there. It would be a wear a mask and social distancing sign, I think would be the most appropriate ones there. We'll take care of that tomorrow.
Thank you.
Okay, thank you, Rebecca, and thank you, Matt, for taking care of that. All right, let's move on to subgroup reports, and data is up first. So Kent and
Okay.
Rebecca.
Yep. So I'll kick it off with a bit more data. We've talked about a lot already, but just some benchmarks on the 3 counties in Maine that are unable to open their inside dining. Of the total positive tests in the state, Cumberland County accounts for 51%. York County is 16.5%, so a distant second, and Androscoggin is at 14.6%. So some interesting numbers there. Back to talking about the age groups for a second. We reported on age groups a couple of weeks ago. And on 26 May, the age group of under 20s then accounted for 4.5% of the total positive cases in the state. That's now 6.4%. Those in their 20s went from 12.5% to 14.6%. And the 30s went from 13.6 to 14.8. 40s stayed relatively flat, and 50s were starting to see a decline over that period from 18.4 down to 17.3. And then the age groups after that are also going down. So there's a bit of a correlation to what Eric was saying earlier. So we'll continue to watch that data and see what happens. Again, my thoughts are as we start to staff up our businesses this year, with some of the younger folks, something just to keep our eyes on. We now have data at the zip code level, so we've been digging around a little bit in that data. Agunquit is reporting 0 to 5 cases. So if we look at that as an average and say, well, it's 3 cases, that's 0.32% of our total population. If we compare that to Portland, they're reporting 202, which is 0.63% of their total population. So again, we'll keep an eye on those numbers and see what happens. If anybody has questions right now about any of the surrounding towns of Agunquit, I've got them all in front of me. So Terry Ann might have a question.
Right, Terry Ann, you got to unmute, please. Thank you.
Yep. So Kent and Rebecca, you know, those of us who live in Agunquit probably in any given day are in 3 to 4 different zip codes. So, you know, I buy my gas in a different zip code. I grocery shop in a different zip code. I do other kinds of shopping in a different zip code. My grandson lives in another zip code. So most of us who live in Agunquit, you know, are in and out of zip codes in public or in public places multiple times, at least in a week. I'm at the golf course, which is in another zip code. I mean, so as we think about spread and the numbers of people, should we not be looking a little bit more broadly to really get the lay of the land about infection spread? It's just a question and a thought.
Yeah, those are good questions. And as I look at the surrounding towns, they're all, you know, as a percent of the total population of those zip codes, they're all relatively similar numbers to what we're seeing in Agunquit. Not to say you couldn't contract the infection in a neighboring zip code, but yeah, I don't think we have the data of infection rates by zip code to say where there are any hotspots. But if you just look at the raw data for these surrounding towns, they're all relatively low. As a percent of total population, Cape Nettic is on the high end at 0.45%. So again, a relatively low number. Yeah, so I looked at Cumberland County and I looked at York County, and the further north you get, the higher the percentages get. So, and I also looked at the surrounding counties in New Hampshire and the counties that tend to visit us in the summertime to look at those rates too. So I'm trying to draw some correlations there and detect any risk in those areas too, as we begin to start opening up more things to keep in mind. The last thing I have to report on this week is Matt gave us some vehicle count data last week, I think it was, and I had a chance to dig through that, and I can't draw any conclusions from it. We had some northbound data. There was a counter near the Playhouse box office on Main Street, 102 Main Street. That was data from April through the end of May this year. And then the other data I had to compare to it in one of our seasons was 2018, and it was data from May 4th through May 26th of 2018. And that counter was by the Scotch Hill Inn. And I think, Matt, correct me if I'm wrong, but I think it was traffic heading southbound through the town. What we were trying to figure out is, can we extrapolate any day trip density rates by looking at vehicle counts? And I really can't from the data set that we had, and maybe somebody smarter than I can. So I looked at May of this year versus May of 2018 from two different data collection points, just seeing if there's any correlation. And the only thing I could draw out of that for the same time period, the month of May this year reflected 52% of the traffic, at least going through our town. than May of 2018. So not much I can draw from that, but I do want to talk to you, Matt, offline to see if there's any way we can collect other data and figure out how we can track cars in our area to see how many cars stay in the area for any period of time, to see if we can extrapolate any day trip data from that, because we're having a bear figuring out the density of town. Unless anybody knows of any aerial imagery of the town, and we can start trying to figure out how to do some people counts that way in certain areas of the town that we're concerned about. That's what I have, and I think Becky's got some stuff to report as well.
My turn?
Yes.
Well, I'm just going to talk briefly about something I found in the New York Times this week that I thought was really helpful. They published 5 safety rules, and they're very concrete, down to earth, that we could scan just to make sure that we're doing everything we're supposed to be doing or that we want to do to stay safe. So I'll just briefly run through them, but I'll send them to Cheryl for the minutes. I have a feeling she's having a hard time keeping up with minutes of all these groups. And also to Pam to put on the website. The first is to check the health of your state and community, and particularly pay attention to that positive test number, which we know is doing really well at the moment. There's a few websites that are easy to check: Maine CDC, the daily broadcasts, the coronavirus website for Johns Hopkins, and the COVID Act Now website that Kent has talked about in the past. The second is to limit the number of your close contacts, have a limited social circle with people that you trust, and establish what kind of rules about risks you're going to abide by between yourselves. The third is to make an exposure budget. So choose the activities that are important to you and skip the ones that are less important. So make some trade-offs as to what you're willing to do and what you don't need to do at the moment. The fourth is to keep high-risk activities as short as possible. Keep indoor close contact to 10 minutes, and things like haircuts and shopping about an hour. And the last one is to keep up the precautions. So don't lose sight of social distancing. Keep a mask handy. I know I now have one in my car because I've forgotten to bring it. Wash your hands. And if there are reasons for you to be stricter, sort of like Eric spoke about his parents with comorbidities, that you might want to practice stricter precautions based on your particular situations and the people that you're with. That's it. Thank you.
Thank you, Rebecca. Okay, any questions for that subgroup? If not, we'll move on to public health, Terry Ann and team.
So the first thing I wanted to share with you was, if you recall, Joan Griswold made a presentation to our task force when we recommended that Marginal Way be opened on June 1st, and had recruited some volunteers because they do have a counter that counts how many people use Marginal Way. And she had recruited some volunteers to do some counting of people who wore masks, given that you really can't social distance on Marginal Way. She sent out an email. She got a good response of volunteers, but she sent out an email to them before they got started, just reminding them that they are only observing compliance with the request to wear masks when people can't physical distance, and not to do any kind of intervention. It was a very nice email, because I think a lot of people have been concerned that if you're trying to determine how many people are complying with the request, that it could be contentious. So she sent a very nice email, and then just sent to Scott, and I just got it today, that since June 1st, I think, there have been 4,300 visitors to Marginal Way, compared to last year in the same number of days to 11,600. So there are a lot fewer. And she has, people are observing either when they're walking or from the lighthouse or from, you know, their front yard. And she, the first week that they've done this, they have a 5-day average. It's 5 days, actually, not 7. 5-day average compliance of 49%. And obviously the goal is 70%. However, the signs haven't been up for that long. It hasn't been open for that long. And I think what's important about those numbers is we fully expect to see them increase over time as people learn more and more. I did see a little chat come up asking, are people gonna be cited if they don't have a mask? Are there gonna be some enforcement efforts? And I will repeat again, as I have a million times, we're trying to encourage people to protect themselves and protect others. It takes time for people to think differently about how they go about business, and individual enforcement actions citing people is not gonna get compliance any greater. So I wanna thank Joan and her group for doing this. I think it's really important, and I'm sure they'll have some thoughts down the road about some things that might be more helpful, whether it's additional signs or whatever. And now that the state is making resources available to towns, there would be some additional, potentially additional money to be able to put more signage up. So I wanted to share that with you. The other thing I wanted to share was that earlier today, the governor renewed the state of emergency for another 30 days. And third, visitor services are starting to collect monies from our parking lots. They've got all their PPE, but there's a very high level of anxiety. So because they have to have contact with people when they're processing credit cards and that sort of thing. So as you see them, I hope everybody will thank them and encourage them for, I know it's their job, but there's a high level of anxiety as they begin to have contact with the public. And I think they're anxious about reactions that they might have to deal with folks who don't wanna use face coverings or socially distance. And the final thing I wanna say is really, I have a question, and I may be stepping in mud up to my hips, but my question is this. Given the rapid spread in quote unquote congregate settings, I know in Ogunquit we have a number of what I would consider congregate settings where our summer workforce lives. And I guess this would be a code enforcement question. Are we doing, or maybe Alice knows, are we doing anything at all in town to encourage the owners of these congregate settings for employees to help employees comply with the practices that we know keep them safe?
I can see just from conversations, and again, we probably interact with about 50% of our members fairly regularly, and the other 50% are members that may or may not be participating very much. But our hospitality businesses especially are very, very, very vested in keeping their spaces safe because they know that's what's going to attract visitors. So the chamber has free signage available to all of our members and to any business actually that wants to put it out. So social distancing, hand hygiene, and what masks. And businesses are taking that just as seriously with their employees as they are with their guests. And all the business checklists have a section that talks about addressing employee safety and wellness. So I think the information is out there, other than providing the information, providing the science. We haven't had seminars about it or anything like that. It hasn't risen up to us as a need, really. I do think that it's part of getting, reopening again. But, certainly if you see any situations where we might have an opportunity to educate a business, we'd be happy to do that.
And Buzzy, do you have anything to add?
Just to thank the Marginal Way Preservation Society or whoever's doing that. That's some interesting data. It's just the way, just an idea, and grateful for that, and grateful for that gentleman, Mr. Fogg, who spoke earlier, and all the information. And that's it. Yeah, that's it.
Okay, thank you. Charlie, do you have any further comments from an at-risk subgroup perspective? I have to unmute.
Unmute. Okay. Can you hear me now?
Sure.
I assume you can. I just want to thank Eric Fogg, and he gave us some great information, and I knew he'd be helpful to us. And he says he's willing to come on and talk to us again if we'd like, or at least provide information. And I'd like to suggest that we do have him on again, possibly for, maybe a brief time. He can take my spot. I'd be glad to, cede my time to him, because he has more current and up-to-date information, especially for Southern York County, which is really what we're interested in, obviously, and the broader facts than Kent and Rebecca can give us. I would just like to say for the at-risk people out there that that article in the New York Times that Rebecca referred to was also very helpful to the at-risk people, all of us in general, but especially to us that are at risk. And your question, Bob, to Eric Fogg was a very pertinent one about what he does and, with his parents. And those of us in our 70s can very much relate to that, especially those of us who have comorbidities, as he mentioned. So it all boils down to basically isolating yourself if you're at real risk, and then limiting your contacts and educating yourself, as Pam and I have been talking about for quite a while. And the bottom line of wearing a mask when you're in public and you can't social distance, and washing your hands on a regular basis, and carrying hand sanitizer with you, those things go a long way. And like Rebecca mentioned, I carry a mask with me in the car now, and pretty much if I forget mine, if I get to bring it with me, I've got one in the car, so I can actually go into a grocery store or the post office if I need to. And the other bottom line is, the last thing I'm going to say is about outdoor spaces. And that's why I mentioned that I'm for any and all things that will help the businesses in town, especially opening outdoor spaces, because this particular disease, as I've heard from a couple of different sources now, tends to spread less in outdoor spaces, even when you can't social distance. And the proof of that has been, so far, of all these protests. They thought that it would spike dramatically, and it hasn't yet. And they did put a caveat to that, that there might not have been enough time yet, but they thought by now they would have spiked in a couple of the major cities. So anyway, I'll leave with that, and thank you very much.
Okay, thank you, Charlie. The last is the music in the park, but Pam has left, but she did leave her notes here. So if you want to read these notes, maybe I'll read these into the record. So the Music in the Park group had met, and they will be following the governor's guidelines. The gathering should be 50 or under. They have unfortunately canceled the swing band. because there's 25 people in the band itself, and that counts to the total 50. Social distancing would be adhered to and masks will be required if this cannot be accomplished. They will, I'll add the word, they will be following the task force recommendation that groups of people seating together need to maintain a 12-foot distance, like the beach, or like on beach blankets and umbrellas. There will be no tables set up for handouts or literature. Signage is being developed and will be strategically placed so residents and guests are made aware of the COVID protocols. Parks and Recreation will be asking that a CSO person be available on site during the concerts. So that's read into the record from there. Matt, do we have any hands raised?
Yeah, there is one hand raised. It's Amy Forbes. Would you like to hear from Amy?
Sure.
Now we have two hand raised. So Amy, go ahead and unmute.
Good evening. I just got home from work from the Cove, so I only heard parts of the meeting, but the part that really blew my mind and flabbergasted me was Dr. Fogg, who got on and said that in the last 2 weeks, there's only been 5 positive cases out of 647. And I'm wondering where this is all going, because all I hear about being in Perkins Cove is all the Massachusetts license plates in Connecticut, in New York. So I'm wondering why, number one, which you can't answer, why we're not open completely. And number two, why everyone's talking about the number of people that are in town, which aren't here, and how we're going to move forward. It's very conflicting as a business person to listen to these meetings, and in the end, it goes to the select board and nothing is really figured out. So the doctor from York Hospital just blew my mind. And like I said, I only heard part of it because I was at work. So I don't know if anyone has an answer to that. I mean, 647 tests, 5 positives, no one at York Hospital with COVID-19. I know that at Southern Maine Medical, they've taken one of the floors and turned it back into psychiatric ward. That was a COVID-19 floor. The hospital in Sanford's only doing non-COVID things. So I'm just wondering why we're talking about not being open.
Well, Amy, good to hear from you. I'm not sure that any of the opening protocols are within the purview of our towns. As far as I can tell, openings are in the purview of the governor. So the governor has opened retail to some level and opened restaurants to some level. The task force has tried to find ways to make it more palatable for businesses or easier for businesses to make money by encouraging the select board to allow outdoor dining outside of code. And we'll continue to look at things. And I think that was one of the things we tried to talk about. We didn't have enough data yet on other things we might do with public spaces. But as far as opening or closing, or we haven't closed anything, we've opened the beaches, we've opened Marginal Way. We're trying to keep things safe, but we're not responsible for any further opening protocols that comes from the state. Anyone else on the task force want to address this? No. Okay. Matt, next.
Mike Blazejowski. Mike, if you unmute, you should be able to talk.
Thanks, Matt. Guys, I have a comment from an observation this past weekend and also then a question. The first is from this past weekend. So I, both Friday night and Saturday night, ventured out and had dinner at 2 different restaurants in town. And walking down Shore Road both evenings, The one thing I will say that's been pretty impressive is how the current restaurants have been able to utilize the outside space that they have available, and actually has made almost a new distinction in terms of the town. I think they've all done a really good job of setting up where they have available space, and it's brought a whole new element, I guess, into the downtown dining to actually to the point of, I think, post-COVID is something that may want to be considered later on. And again, I know not within the realm of this group, but certainly they've done a nice job. So the comments around opening up, closing Shore Road and opening up public spaces, I question where that may be coming from the standpoint of I saw a lot of restaurants utilizing their current space, and both restaurants that I did visit were nowhere near capacity. Certainly, with the space they had available, could have taken a lot more people in. And the difference Friday to Saturday. Friday was a beautiful night weather-wise, right? So the ability of to have outside dining was much better on Friday than it was on Saturday. So my comment there is I think they've made do with what they could, and I'm not sure that closing off a section of Shore Road is going to make that much more of a difference for what they can do. The question I have for the group, I think, goes back to Bob's other comment about the bridge going into the beach. And Bob, you made a comment about possibly making it one way each way. And certainly, I think that is something that probably needs to be looked at. But what I would also question the group on, and I have heard that this has been brought up in other meetings, is the fishing off of that bridge. I know it's not a constant, but as the season goes on, more and more people are fishing off that bridge, and it makes it very difficult. Even if we were in one-way traffic, very difficult to safely pass by somebody on that bridge. I think it's a safety issue, non-COVID related, but I think from a COVID standpoint, that might be something, a recommendation to the select board would be to consider no fishing off of the bridge. They have many other opportunities to fish off the beach, and I'm concerned that that's something we probably should take a hard look at.
Okay, thank you, Mike. In our last meeting, we voted unanimously to maintain fishing. I haven't brought that unanimous decision to the board, and the board will take that up at their next meeting. And we will be taking up the direction of pedestrian traffic at the same time. Matt, next. Anybody else?
Yeah, Joan, you should be allowed to. There you go, Joan.
Thank you. Okay, I just want to get some clarity here. I'm afraid I did miss the beginning of the presentation tonight, but I'm a half-year resident. My goal is to come next week and settle in for the summer. I'm coming from Massachusetts. My husband and I have looked into availability of COVID testing here in Cambridge. Right now, we found two options. One is that you pay, I think, $150 for a fast test. Otherwise, the waiting for the results is beyond the 72 or 32, whichever it is, hours of time that needs to elapse. I just want, I hate to put a burden for testing on the state of Maine, but I'm just trying to clarify, are we able to take part in the drive-through testing at York Hospital and then go self-quarantine until we get our results? Does anyone know how that would work for us, or?
Yeah, maybe somebody from public health, you can, because I was my question too. We have a standing order, I think, to Terry Ann, you want to cover that one?
Yeah, I'm just not sure when it starts. I do know that York Hospital has just finished setting up their one mobile drive-through testing facility, and the standing order does apply. So I would urge you to call York Hospital and ask if you can do it. And it is the rapid test. I think you would know the next day, but I would encourage you to call them. They just finished setting up their first mobile testing site. The state won't have their mobile testing sites ready to go, I think, until July 1. So, but you could check with York. And it's, if you have Medicare, it's covered. If you have any insurance, you need to check with your insurance company. If you pay out of pocket for the rapid test, it's, I think he said $220 if your insurance doesn't cover it.
Okay, well, thank you. I have Medicare, so that might help. And, you know, just, it's a little confusing, you know, and it's a little hard. People want to do the right thing, but it gets hard when day trippers come in and out and there's no way to trace them. And, you know, half-time owners of property in the town, you know, have less freedom. So anyway, thank you. I will call York Hospital. Thanks.
Okay, thank you. Matt, any more? We'll take one more if there's another one.
No more raised hands.
No more raised hands, okay. I don't think we have, unless someone has a motion for recommendations, I don't think, the only thing that I would be, Rebecca.
I'm just wondering whether we couldn't develop a checklist, sort of like the planning board uses in terms of using public and private space. That's what I'm thinking about. Maybe we could do something like that to help the select board and to help Pat.
Can you give me an example of what I don't know what the planning board does.
For example, is this proposal, are the police okay with this proposal? Is the fire department okay that an emergency vehicles can have access? Have the abutters been notified? Would this create more congestion on the sidewalk? It's sort of a checklist to go through. Because I think some things that we suggest are going to be good in some ways and create more problems in other ways. And if we could sort of break it down by potential problem, that when you finish going through the checklist, you would have a sense of whether this would be a good thing to do.
Okay. Probably that's something that the business subgroup should take up, because I don't think we can develop a checklist with the 9 of us, but maybe Alice, you have a comment on that?
Well, I know that one of the things that we discussed in our business subgroup meeting the other day was that when I spoke to Pat on Monday, she seemed unsure as to what the select board was allowing her to do or not allowing her to do. And I don't know if she's gotten further clarification since then. So, you know, one of the things we talked about was like kind of clarifying the sharing of the private space, and then, you know, clarifying a procedure as a way of maybe helping Pat define that, you know, have the task force backing to define that for the select board. Now, before we do that, I think I should check in with her and see if she still needs that kind of support. But I think we should probably, you know, ask her if I'm also not familiar with how the planning board works, but if she would need any kind of a checklist, or she already has some kind of a protocol in place where, you know, if there's a question, she talks to Chief Pat about this and she talked to Chief Smith about this. And I don't know enough about the workings of how she works with her team at the town office to know if she would need that kind of support or not. And you guys might, I just don't know the answer to that. If that kind of support is needed, it's certainly something that our business subgroup can talk about developing.
I think in my opinion, if we do take on the role of being involved in public spaces and allocating them, if we did as a conditional, a checklist would be a good idea, because then we can make sure we've covered all parts of the town and the people who administer the town. I still think we need to know more from the chamber and businesses whether they're interested in public spaces, because it doesn't seem like we know that. And I'd like to know that before we move on. But if we were to take up that task, I think a checklist would be a good idea. Any other comments regarding any potential motions or recommendations? Charlie?
I just want to thank the people who've been in touch with me about the Age-Friendly Community Committee for Ogunquit, and encourage others who might be interested in getting involved with the AARP Age-Friendly Community Committee. We've got a heck of a group already, some from the legal field and some from the medical field, and others like myself. I'm a social worker, and a few others from different areas. So I'm very encouraged. I'd like to get up to like what Kenny Bunkport did. They had 50 or 60 people getting involved. And the city of Saco happened to look at their board of directors the other day for their age-friendly community committee. And it was impressive. People from the select board and people from, all kinds of businesses in town were very, very supportive and on the board. So I'm hoping to get to that level pretty soon with our committee and then make it a formal committee in town. So thank you to the people who have gotten in touch with me already. And I look forward to more people contacting me. And thank you to Heath Willett on the select board, who's also helped me with this and to get other people involved. So I really appreciate that. Thank you.
Okay, thank you, Charlie. Anything else that anyone wants to say before we close? Rebecca.
I just want to say that that NAMI website for Maine mental health support is a really good one. Pam is going to put it up on the website, and also an article about how to talk to kids about COVID. And so there's some really good resources there if people have concerns about their mental health or someone else's, how to deal with stress.
Thank you. Charlie. Charlie, we can't hear you. Still can't hear you.
Hang on. Okay, am I unmuted?
Okay, I unmuted you there, Charlie. Somehow I have the power now to mute and unmute you. I like this. I just found this out. Thank you, Matt, for giving me that power. I know you did that.
You're welcome.
Okay, you are now unmuted, Charlie.
Okay,
But careful.
Rebecca just brought to mind that while I was watching the press conference today, Commissioner Jean Lambrew of the Department of Health and Human Services was also on the press conference, and she brought up the fact that the state just got another $1 million from the federal government, a grant, to help Mainers deal with the mental health issues of the COVID-19 pandemic. So she mentioned some of the things that they were going to do with it. And some of it was going to be for individuals to get counseling in that way. Not only children, but all ages. What I might suggest, and I suggested this before, is we have an employee of the town, David Riccio, who is really good at writing grants. So
we might pursue some grants for the town, not only for mental health, but maybe for other areas. And as I said, I've mentioned that before. And David's procured some pretty darn good grants for the town in the past. So possibly there's money involved where we can get some more grants to help us get through this pandemic and maybe help businesses and so on with this. So thanks for listening.
Okay, thank you, Charlie. Buzzy, I saw your hand raised.
Yeah, let's pass those grants on to communities that might need them a little more than poor Gunkwit. That's that.
Okay, thank you. I noticed that the governor put together a $13 million fund for cities who did a really good job of educating on COVID-19. I'm guessing not much of that is coming our way. Okay. Do I have any other comments or a motion to adjourn? Charlie has a comment or a motion? Oh, I'm trying to unmute you, Charlie. Now I can't unmute you. Oh my goodness, they took it away from me.
Motion to adjourn.
Okay, do I have a second? Buzzy, second. All those in favor say aye.
Aye.
Again, thank you all for your service, and I hope your subgroups meet this week and talk about things that are important to our town. Have a great evening.